Hi, welcome. Good afternoon all. Thank you for coming to our channel and listening us live. So today we are here to talk about some topic like autism, which is a very hot topic nowadays among parents. You know, they're all worried like autism, is my child autistic? So autism is a very hot topic and we are in the Autism Awareness Month. So I'm happy to be here doing live and I hope all of you can join us very soon. We have few friends, you know, those who have already joined. We have Mr. Deepak who is joined and we have Jyoti, and we'll wait for a few more seconds for a few more people to join, you know, so people will know we are on live and we can answer all the questions by them.
Yes. Hello to Mr. Dolphy. Yeah. Mr. Nigel. Hello.
I think everybody is slowly joining up.
You know what? Autism. Sometimes some parents are so. What's this? They are so afraid to consult a doctor or to seek help.
True, true.
So
And I'm sure we are going to answer all these questions today, you know, which will make our parents more comfortable and know better about the condition.
Exactly.
So, you know, like all the confusions and all the conditions that they have will be actually answered today by us. And
even one of my friends, it's like, oh, my kid has no eye contact. I mean, does he have autism? So from here, Neethu will discuss and we will find out what are the symptoms of autism.
yeah, true, true. We'll cover all the areas, no worries. We'll cover all areas like signs, symptoms, and what causes, what should we do as a parent. Everything will be answered by us, and we hope we have more audience, those who are really, you know, worried about these things, and we'll be able to answer these questions to them. Maybe, you know, very soon we can go live. We have a few more people joining in.
Hello, Nigel.
And we have Reshma who's joined up. Yeah. Let's wait for a few more time and we'll have more people to join in, because we don't want anybody to miss our talk today. So,
and it's interesting topic.
Yes.
Since it's Autism Month. So.
Sure. So welcome all. I hope we have sufficient people to start with. So I would like to start with a quote today. I don't want to be normal. I want to be accepted. And I'm sure that, you know, by this quote, most of the people will understand what we starting from the age range of 2.5 to above. I handle children with all child language disorders, autism and other conditions. So we have Mr. Santi with us.
Hello, my name is Santiago, occupational therapist, and I'm working with kids for more than 10 years now.
Yes. So I would like to, you know, tell a little bit of autism, like what's the definition, what we need to look into it, because I'm worried, you know, some of the parents, they don't know what's the difference of autism and delayed in speech and language skills. So what is autism? Autism is a neurological condition, you know, where the child has brief characteristics like poor eye contact, poor social skills, no socialization with the peer group, language is being affected, both verbal and non-verbal. And you know, it's very important for us and the parents to know if these signs are there. Usually all children before the age range of 2, they show all these signs, but we need to be very careful after the age of 2, because it becomes very, very easy for us to see if the child has the condition.
Yeah, just like you said, sometimes the parents are hesitant to seek help. It's like once you see the obvious that there's this signs, and for me it's better to seek help immediately. So the earlier the better.
Yeah. Santi, we have a question in our Instagram.
Okay.
Mr. Chini asking us, how is autism diagnosed? So
Good question.
I would like to go ahead with how is autism diagnosed. So as I said earlier, usually we see all the conditions or signs and symptoms in children before the age range of 2. But after the age range of 2 years, please visit your pediatric doctor, a pediatric neurologist and a psychologist. It is very important for us to see if the child has the correct symptoms. Like once the parent is worried, they go to a pediatric neurologist or a developmental pediatrician. They go through all the milestones and they see is the child having a normal delay or it's on the symptoms of autism. What do you say?
Yeah, just like you said, it's like if you have this, I mean, you're worried or your kid might have a delay, better to seek help. I mean, just like I said earlier, the better. Because I have experience before that the parents is just waiting. Maybe he will grow up with it. It's like once he started school, the teachers started to notice it, and it's going to be hard if if the kids
Age is a little older.
yes,
Yes.
it's going to be tough. Just like I said, it's not the word tough. It's going to be hard, but the just like I said, it's early. The earlier, the better.
True, I agree with Mr. Santi, because as the child grows older, he's already learned these behaviors, and then to correct the child with these behavior becomes harder. So it is very important for us, once we see the child has some problem, like, I would like to pinpoint some of the signs that we need to look into, or a red flag, that for example, if the child is having poor eye contact, the child doesn't have an index finger pointing, or if the child doesn't socialize much with the peer group, it is very important for us to go ahead, check with the doctor, and take whatever is needed.
Just like Ms.Neethu said, if you see these symptoms, because sometimes if only one symptoms, you just need to wait for more. Because sometimes
True,
it's only
true.
one symptoms. My kid doesn't have eye contact, and he's 2 years old, and sometimes they just playful and doesn't
True.
doesn't show eye contact. So as Neethu said, if you see the signs and the red flags. So.
Okay, I can see another question which has popped up. That is from Reshma, and she's asked in Facebook, how to help a child calm when he is up with behaviors that is shouting, running, and crying. I think maybe you can talk a little bit more about it.
Yes. For this one, let's go. For me, we need to find out what causes the behavior. Maybe maybe it's a sensory, or maybe it's not. It's more of a, first let's find out what happened before that. Maybe someone just grabbed his food. Kids will cry. But if he's doing it a lot, let's say he keeps on running, he keeps on shouting without apparent reason, then probably it's a sensory. So there are calming activities that we do for this kind of physical activities, such as put a weights up. But you need to consult your occupational therapy first, which exercises suited for your kids or suited for this kind of sensory seeking behavior.
And I think also maybe something like the deep compression can help the
Yes,
child.
thank you for that. Deep compression, it relaxes the child. Some activities just like finger painting, activities just like obstacle courses. These activities calms the kid, and they will have better attention afterwards.
Thank you, Santi, for helping us with the OT question. When it comes to speech, I would like to say a little bit more, because I think, our job is a little more harder. It's not as fun as yours, because we are mostly focusing on a tabletop task. So when it comes to speech, if the child has a behavior, we first look into what caused the behavior, exactly like what Mr. Santi had said. We need to find out what is causing the child to have this behavior. For example, a child is doing a puzzle, all of a sudden he cries. So we need to know what exactly happened. Is it because we wanted to do a sharing activity, or the child wants to do it by himself? So all this matters. So it's very important to exactly find out what's the cause of the behavior. And for sure, I also feel that if the child is very hyper or attention deficit, you can always see a neurologist. If it's necessary to have any medication which cannot be controlled by the therapist or the parent, it's always good to also consult if we cannot actually control the behavior.
Yes, speaking of that hyperactivity, it's not their fault, by the way. Please, it's not
Yes.
their fault.
Yes.
It's in the system. It's just like, I need to stand up. I need to run. It's like, but I don't know how, right? It's like, I just want to stand up now. But for
Sure.
occupational therapies, we do it in a meaningful way.
Sure.
Like maybe we can have a race while running,
Yes.
right? It's more
We
of a
have
fun
another
stuff.
question, Mr. Santi. This is from Sabah.
Hello.
And she's on Facebook. She's asked the question, can you share a technique to get responses pointing from a nonverbal autistic child? Sure. I would like to answer this question in the
Yes,
beginning,
please.
because I think I play a major role here. So I would like to go ahead with the answer. So for example, when you want to teach the child a pointing, there are different techniques that is called the prompts. So there are prompts, fully prompt, partial prompt and zero prompt. So initially when we start with prompting, if the child needs, for example, his needs, basic need is water. He wants water, he cries, he comes stand in front of the water and he cries. So what we need to do, take our hand, give the hand to the child and ask him to point. So for example, if I have a child, I take the hand of the child and then ask him to point. So this is full physical prompt given for the child for his need. Slowly going ahead, giving him 10 trials, 20 trials. Every time he needs this, give him the full prompt. After 10 to 15 trials, see if you can reduce your physical prompt. That is from taking the hand fully, just see if a little bit of push if the child can point. So that is how we help the child in pointing and asking for his needs. So this is how it works in our area. So maybe if you can help.
For the occupational therapy part, at least the kid needs to learn his body position. It's like, is it my index finger, is it there? So for occupational therapy, it's more of a concern for that. Does he know his body position? Does he have eye and hand coordination? Does he have that? So for me, working on these skills will also help kids with non-verbal to do pointing for requesting. That's for occupational therapy.
True, true. So it is very important, rather than just demanding from the child, give him a prompt or give him a help that can actually help it. So it is very important to always prompt the child or give the help and then go ahead with, helping the child to do pointing. You can do it in many different aspects, not only for his, actually his reinforces or his demands, but also even for learning. When you say, okay, body parts, okay, where's your eyes, and give him the full prompt to just point. And as Mr. Santi said, using the index finger is very, very important in a child while pointing.
And make sure the child is looking.
Exactly, the child looks,
attention.
The child's attention is there with you to teach the child this aspect. Okay, so we have another question again coming up. So that is from Ms. Shally.
Shally, yeah.
My child can now speak but still have problems in expressing herself and her feelings. Some SLP said that she doesn't need speech and language. Is it true? Thank you for the question, ma'am. I would like to address this question like we need to see, by just reading this question, we need to know a little more details about the child in this case. We need to know what exactly the age of the child is. Have you done an assessment with the speech language pathologist, or what have they guided you? It's only the matter of that the child cannot express his feelings, and what about the other language concepts? So it is very important for us to actually know more details about it. But I would suggest, when your question is regarding like her expression skills, some children are very good with their comprehension. And I would also say bilingual language, like two people or two language at a home. Maybe if you're an Indian, you speak Hindi and English, or if you're another nationality, Arabic and English, or French and English. That actually confuses the child when it comes to talking. So for example, he may understand, for example, like come, and the regional language has another word. The child will understand both, but when he has to say, come mommy, the child will be just thinking, okay, what is the word that I should be using?
Okay, so
yes.
Is it maybe only the gestures that he will understand, not the word, but only the gesture?
The child will also understand the word, but only when it comes to talking, as I said, when there's two languages at the same time used, it may be difficult for the child to actually identify what word to be said. So it is very important for us to use one language, and it is very good that you also consult an SLP, because as I said, we need more information about the child, the age, and what is the language level of the child to talk more about. So we have another question coming from Jean.
Hello, Jean.
Do you recommend that an autistic child can be included in a regular school or maybe enrolled in a special needs school? Thank you for the question, Jean. Actually, this is again something related to the above question. We need to really know what's the level of the child. And according to the rule here, we know that inclusion is very high prioritized here in UAE. We always have an inclusion category. So if the child has just a minimal problem, they can always go to a regular school with the help of a shadow, depending on the school's demand. So that is very important, yes. But if the child has a lot of behavior issue, he cannot be accomplished in a classroom. As we all know, a classroom has 20 to 25 children.
Lots of distractions.
Yes, lot of distraction and difficult, to get one-to-one attention. So we need to always see the level of the child. It's just a minimal problem like an articulation problem or things like that. Or if it's a high functioning autistic child, he doesn't have any behavior. It's only when it comes to talking. You can always go to a school, not necessarily that you need to go to a special need. But as I said earlier, we need to know a complete history of the child before we decide, is the child ready for a normal inclusion? Is he able to cope up with that stress? So all this, his writing skills is very important again.
Yes, plus also in school, there's a lot of demand. The demand is continuously. So the need needs to adjust and transition. The transition is fast. And also, I have experience with that. What happened is that the kids still have some issues and they already send it to a group, send it in school, regular school. The problem is the kid attention span is very low. So what happened was they seek help again. I mean, the kid is not learning and started crying and shouting inside the classroom, which means I mean you understand. It's like, okay, you're here now. You're on your own. At least a kid needs someone to show him or to prompt him how to work in school or how to attend school.
Yeah, maybe we can ask. We have a few more questions to be answered. So we're sorry if we are a little faster. So we have a few more questions to be answered. So next we have Ms. Karishma.
Hello,
She's
Ms.
asking,
Karishma.
if your child is a very picky eater and runs away from all food and has specific food habits, how can you help to develop like eating?
Okay. So if a kid is picky eater, we need to know why first. Why? Does he like hard substances? Does he like soft substances?
So mainly it's the sensory input that has the child. Yeah. That what is the reason of the child not eating some kind of food? So in my experience, what I would say is some children, they mostly don't like to eat smashy foods, like they the child, and then we strengthen those muscles and then we give them different kind of food. So first, before feeding it with the mouth, we try to ask the child to play with it. For example, if it's the banana, we would just ask the child to just smash it, feel how it is, and then take the oral input. So eating can always be fun if you if you take your child's help in kitchen and make a little bit messy play. So that makes it a fun thing to eat. So that is how we help small children to start with feeding. And we have another question that has come. That is from Yasdi. She's asking, we badly need help for picky eating. Any tips? As discussed earlier, the same question was asked by Ms. Karishma, and she also asked the same thing. So as I said, before you push the child to eat, start playing with the food. Give the child, let him start making it messy, let him enjoy the feel. It is just the sensory that the child is not able to take it. So I think maybe you can try doing some messy play with the child. Play with yogurt, play with mashed potatoes, play with bananas, give it to a doll, ask the doll to take it first, let him feed maybe somebody else if daddy is at home. You cut the bananas or any food that you want to try, ask the child to feed it to another person to see, yes, this is how it looks. And start with small quantities, not a very big or a spoonful of mouth. So just start with small quantities so the child can take it over.
And plus also, I mean, you can show the kid videos of kids eating, right? So visually she will learn.
Yes. Okay. So we have another question from Ms. Mary Ann. Is it enough to conclude that my baby is autistic just because he cannot speak at his age? He's already 2 years, and this is from Facebook. Most of our questions are coming up from Facebook.
Hello, Mary Ann. Yeah.
So no. Only because your child is not talking or the child cannot actually communicate with another person, no. As I said in the beginning, there are some red flag signs that the child is not talking verbally, or the child doesn't have an eye contact, the child doesn't use the index finger for pointing, poor social skills. Even with the want to play alone, the child has some repetitive behaviors like flapping hands, or the child wants spinning objects. So there are so many signs that you need to just look in. Not only because he's not talking, he cannot be an autistic child. So if you have any confusions, please visit your pediatric or a developmental pediatrician to see the child has all the normal milestones, or is he age appropriate? If not, they will again refer to a consultant like a speech therapist or an occupational therapist, a psychologist for detailed investigation, and that is when we know that yes, is the child autistic or it's just a normal delay. And we have the next question from Basha. My child is going to be 2 years, but still he can say a word, mama and papa only. Is it sign of autism? Sir, thank you for the question, sir. As I said, the last 2-3 questions were something similar, and my answers are the same. Just the child only saying one word, it's not autistic. But the child here to be highlighted is the child is 2 years and only saying, you know, one word like mama and baba, which is not enough. By the age of 2 years, he should be having 1,500 and above words. He should be able to say question and answers. He should be able to give more sequencing activities. So you need an evaluation, that I would say, not for autism, but for a delayed language. So you need to consult immediately a speech language therapist who can help you. As Mr. Santiago said earlier, early intervention is very, very important rather than just waiting and delaying it further. I hope I answered that question. So we have another question coming up from Dhanya. Thank you, Dhanya, for the question. My child is 2 years, 8 months old. She has good eye contact and interaction with the family members, but not with other good kids. After lockdown, child is attracted to things very much. Thank you, Dhanya. Maybe you can go ahead with this.
Yeah, just like you said, after the lockdown, I mean, there's a lot of things again to consider with regards to this. 2 years, 8 months, maybe one of it, it's like you need to socialize, or maybe she doesn't play with other kids. Maybe that's one of the reason. But diagnosing it with autism, it's again we need also to know, again, just like what Neethu said, the symptoms.
Symptoms, yes.
Okay. So if you only have 1 or 2 symptoms, I'm not quite sure if you can diagnose it with autism.
Dhanya, I would also like to add the age of the child. As you say, the child is 2 years and 8 months. See, it is again a highlighting. Wait, if the child is more than 2 years. If the child is more than 2 years, the child is not having words, the child doesn't have a proper eye contact, poor social skills, please visit your pediatrician or please visit your speech therapist, and they are going to guide you further. So it is very important, after the age of 2, please consult the specialty. We have another question coming up from Sumi. Mom's emotion during pregnancy will cause autism. No, ma'am, because we don't have much studies on that. So I would not say yes or no, you know, as a cut-right answer.
Because some says yes, because the mother is stressed. So, but still not
too much.
Not too much.
But you know, as I said, there are no much studies which say yes, this is one factor that causes autism. So I don't want to comment much on that, if it's true or not. But as we all know, during pregnancy, it's a wonderful time where the child and the mother has a good bonding. So we want the mother to be happy always at that point. So we have another question which has come in Instagram by Delina. How do you help with sensory issues?
Oh, yeah. Sensory issues, I mean, it depends of what type of sensory issues the kid is having. First, we need to have an evaluation so we know which sensory issues is having. And then afterwards, once we know the sensory issues that the kid is having, then we can do some activities. Occupational therapy is more of activities that we can do to target these issues with the kids, to make him calm and be ready for school.
Yes. And we have another question which has come from Sri Harish. It's again from Facebook, which says kid is putting hand in the mouth and biting on hand when excited or happy. How to sort it out? His hands has rushes.
So yeah, some occupational therapists will advise you to get a bite pendant,
a teether.
Yeah, thank you for that. Teether. Thank you for that. It's like for anytime the kid needs a sensory stimulation, it's there. He can bite it right away. So if he's not going to school, or if he's at home, you can use that at least to to what's this for that seeking behavior, because he wants it something in his mouth, at least not his hand,
Yes.
and something that is has
And it
functions.
can be also a sensory problem. Again,
Exactly.
coming to the sensory issue. So what you can do is you can do some oro massages, like helping the child to relax more. And as Mr. Santiago said, you can always buy a teether which will help the child. So every time the child is going to put his hand in the mouth, help him to take the teether and bite it, because that will help him calm down. Rather than just saying no and trying to cut off it all of a sudden, it's always better to slowly calm it down and bring the behavior down. We have another question that has come from Ms. Jyoti. What is a real life skill will OT therapy help us with? And this question is again from Instagram.
Yes, we can help in life skills just like with feeding. I mean, how's the kid will hold a spoon, how we put it in his mouth, how we'll do scooping and putting on and out the shoes and then dressing. That's where OT comes and help the kid to be independent in those areas.
We have another question from Jean, again from Facebook. She's asking, do you have any suggestions on how to teach the autistic child online? Thank you for the question, ma'am. And I think this is one of the main issue most of the parents are having now after the pandemic, because children with poor attention, it is really, really hard for them to go online. So as I said earlier, it is always good to improve the child's attention before, because as we all know, online sitting and tutoring is like, if it's 1 hour, well and good, but if it's for more than 3 hours, it's difficult for any child to pay that attention. But if it's one-to-one over a classroom, the child's name is called, it's a different scenario of learning. So what you can do is you can always start building up with attention activities, giving him more of fine motor activities, and then starting help making it a fun. So you say, okay, you do this today and you get a rewarded this way. But if you need any further interventions, please do visit us, or please put it in the comment box so we can answer to you personally, and we can give more explanation on the same. So we have another question which is coming from Sabah. They diagnosed him mild to moderate autistic spectrum. He's good in studies but has behavior issues. How can we help? Thank you for the question, ma'am. As you have said, now he's diagnosed, and at the age of 4 they diagnosed him with autism. So maybe he's on the higher functioning of autism, where his language is good and his academic skills are very good. But behavior, again, as we need to see the child, what is the behavior that's affecting the child's development or the personality? Is it the social interaction, or is it one-to-one that the child is seeking more attention? So in this case, you can always enroll the child for a group therapy session where there is more than 2 to 3 people in the group, and they will work on social skills. This will improve to calm down the child's behavior in all aspects.
Yes, again, we need to find out what causes the behavior first, and then we can target those areas, what causing the behavior.
We have another question coming from Doreen. It is again from Facebook, which she says, my son is 18 months, doesn't respond to his name and does not point to things. Thank you for the question, ma'am. So before we go into not responding, I would also like to bring into point hearing evaluation and vision testing is very important before we do any diagnosis, because once we have a clear cut from the audiologist that the hearing is fine, or from the ophthalmologist the vision is good, yes, we go ahead on this. But before we not responding, please do check with your audiologist the hearing is fine. If the hearing is fine and 18 months not responding to name, we need to find what are the other language aspects the child can do, and what is the screen time of the child, because nowadays screen times are very high with children. So we need to actually cut down screen time, and we need to spend one-to-one attention with the child, and we need to give more stimulation to the child. You need to sit with the child, show him books, tell him stories, and that's how we develop the language. So we have another question. Sorry if we are so quick, because we have a lot of questions coming up and we want to answer all of them as much as we can. So we have next question.
From Aura Lucille, what are the other examples of sensory issues? Some examples are tactile issues. It's more of for the touch. Others are for visual sensory issues. It's more of the light. Sometimes it's too bright, or is it too low? Is it too much for the kid, or is it? I mean, that's the sensory issues, and also proprioception. Is it? Sometimes the kid grabs too hard, and sometimes the kid grab it very lightly, so it also affects the writing. So these areas are the type of sensory issues, most of the time, and especially also the vestibular, the balance. These are the some sensory issues.
So we have another question from Lynette. They asked, does vaccines have anything to do with autism? No, ma'am. As I said earlier, there was one more question. Does pregnancy affect autism? There is no specular studies which says that yes, this is how autism is. As I said in the beginning, it is not, there is no cut and right, okay, if you have all these symptoms, it is autistic. So it is very important for us to go to the concerned specialities to know what exactly it is. So according to my knowledge, vaccines doesn't give you autism. It's depending on the study that we have to do a more research on. So we have another question which is coming from Yasdi. Can you tell me more about group therapy sessions? And she's asked us in Facebook. Sure, ma'am. As we in Burjeel, we have group therapy sessions. Here what we do is during the group therapy sessions, we combine 2 to 3 children of the same age range and the same language level, where we ask the children to come and we work on the social interaction. We give them fun activities where they can, actually share with them. We can ask for requesting. So there are a lot of language aspects where we work on. So this is done in group. So we usually recommend a child to come for individual session, and once the individual session the child is progressing, we go ahead with the group therapy sessions. So you can always contact us for the group therapy sessions if you would like to enroll your child for it. So we have another question coming in again. So the next question is from Dolphy. What if my child shows some of these symptoms? And he's asked us on Facebook.
Yes, just like again what Neethu said earlier, if you see those symptoms, I mean, consult your doctor right away. So that's the best thing that that you can do. Consult the doctor immediately.
Okay, we have one more question that is there. Is early diagnosis important? It's asked by Nigel and it's from Instagram. As we discussed earlier, Nigel, early intervention is very important rather than delaying. It is always good. After the age of 2 years, if your child shows any of the signs and symptoms, please check with the specialist. I think we are running out with the time also, Mr. Santi.
Yes.
So maybe, we can just cut down and we can slow down slowly the live.
Yes, thank you very much everyone for joining us today.
Thank you so much for joining us on live, and I hope we answered some of the questions that was asked on live. But if we have missed by chance any of the questions, please drop in your questions in the comment box and we will surely answer these questions. And you can also visit us in Burjeel Day Surgery Center, Reem Island for further questionings, and we are here to help you. Hope you all liked the show.
My name is Santiago.
And this is Neethu. Thank you for listening us live.
Have a nice day.